In this tutorial, you're going to see the management of fractures. Now, for the management of fractures, generally you need to know that there is a mnemonics. Is it clear? Generally, for all injuries, the first element in the management is going to be a primary survey and ATLS protocol. That's why the mnemonics in the management of fracture is the 5 R's. Is it clear? The first R is going to be resuscitation. Is it clear? You start with resuscitation in fractures. Second R is going to be radiography. Is it clear? The third R is going to be a reduction that you do. The fourth R is going to be restriction, and then the fifth R is going to be rehabilitation. Is it clear? So those are the different R's that you have to evaluate when you are managing a patient. Now we start with the first R, which is resuscitation. Now resuscitation is the part that is involving primary survey and ATLS protocol. And with ATLS protocol, you just evaluate the patient with A, B, C, D. Is it clear? A for the airway and cervical spine control, provided the patient is unconscious. If you have airway and cervical spine control, provided the patient is unconscious, you have to always evaluate and immediately manage the airway. B for breathing. If a patient has a breathing problem, is not breathing appropriately, he has an asymmetry, you have to think of pneumothorax and you have to manage with a nasal decompression immediately. If a patient has a cardiovascular disorder, meaning that the pulses are weak, shreddy, or that you can think of hypotension. If you have a cardiovascular disorder, you think of to do a CPR, a cardiopulmonary resuscitation, and you have to also transfuse the patient. Is it clear? You have to transfuse the patient. D now is for disability. For disability, you need to evaluate that what? You have to evaluate in primary survey, evaluate for the AFPO score, where A stands for alertness. Is it clear? Where you ask the patient, you just call the name of the patient to find if the patient is alert. V is for the voice response, if the patient is capable of responding to your voice. P is if there is any pupillary, if there is any pupillary reflex, the pupillary reflex is present. And then U if the patient is unresponsive. So all these are cases which are associated with the disability. Then E now is exposure, environment and exposure. Is it clear? You need to always expose the body of the patient. Is it clear? To find if there is any injury site. If a patient comes with a head injury, always need to expose all the parts of the body of that patient to reassure yourself that there is only a head injury without any other injury. Is it clear? Those are the different things that you have to evaluate. And then environment also for E, because if you are in an unsafe environment, you have to remove the patient from that unsafe environment to place him in the safe environment for evaluation. So those are the different elements for resuscitation. But we are going to go again into another tutorial to speak more about that. The second point is radiography. Is it clear? Radiography is important in all fractures. That is a prerequisite for all fractures. You have to do a radiography, or even all injuries. Every time you have an injury, you must do a radiography in order to exclude any fracture of that limb. Is it clear? So when you have a radiography, you have to evaluate that what there are rules for radiography. Are you getting? The rules for radiography, we have the rules of twos. The first rule of two is that for the radiography, you must have two views, meaning that it will be anterior-posterior view and lateral view. That's the first rule of two. The second rules of two in radiography is that you should have two limbs, particularly in pediatric patients. Is it clear? Two limbs, basically the left and the right limb, and the affected and the unaffected limb, particularly in pediatric patient. Is it clear? And then the next one, you have the next rule, which is also two instances. Is it clear? When you are doing radiography, you should do it before reduction and you should also do it after reduction. Is it clear? So those are the different elements that you have to evaluate. The third one, after radiography, we have reduction. Is it clear? Now, for reduction, you need to know that reduction is divided into two. It's divided into open reduction and it's divided into closed reduction. Is it clear? It's divided into open reduction, it's divided into closed reduction. Open reduction just means that you are operating and it is during the theater that you try to reduce, you try to make sure that the bone should be aligned. That is called reduction. Reduction is actually the alignment of the bones. Is it clear? You are aligning the bone. The alignment of the bone is called reduction. If you do that after doing surgery, when you are operating and then you are reducing, it is open reduction. When it is closed, it means that you are reducing without seeing the bone in theater. It is closed reduction. Is it clear? Now, closed reduction are peculiarly used when you have dislocations. Is it clear? And there are different forms of reduction technique. You need to know that the reduction technique, the rule for reduction is that you reduce in the opposite direction of the deformity of the limb. That is the major rule of the reduction. The major rule of the reduction, is that you reduce the limb in opposite direction of the deformity. Is it clear? So that is the major rule of the reduction. It means that what? Like in a case of when you have an anterior shoulder dislocation, is it clear? When you have an anterior shoulder dislocation, the limb is going to be in which direction? You're going to have an internal rotation at the level of the upper limb. You're going to have an adduction at the level of the upper limb, and then you are also going to have an internal rotation, you have an adduction, and you have an extension at the level of the upper limb. Is it clear? So you do the opposite movement of that. When you do those opposite movement, you're going to have the Coca's maneuver. Is it clear? So Coca's maneuver just apply this principle according to SchrDbb. That is a simple principle for all the reduction. So this is the Coca's maneuver. You need to abduct, you move in the opposite direction, that is adduction. In the case of shoulder dislocation, you abduct, you externally rotate, which is opposite direction of the extension, which is the opposite direction of internal rotation, and then you flex, is it clear, which is opposite direction of extension at the level of the anterior shoulder dislocation. That is the major principle for reduction in shoulder dislocation, and reduction can be done open or closed. The fourth element is restriction. Is it clear? Now, restriction can also be done. You have what is called internal restriction. You have what is called internal restriction, and you have what is called external restriction. Is it clear? So those are different elements that you have to also evaluate. Internal restriction and external restriction. Now, internal restriction is done when you are doing surgery. When you are doing surgery, you can internally restrict, and there are different elements that you use to internally restrict. You can use just screws to internally restrict. You can use cerclage technique to internally restrict. You can use pins to internally restrict. You can use nails, intramedullary nails, to internally restrict. You can use plates in order to internally restrict. I'm going to send all these diagrams to you in the videos, in the comments part. So when you ask me the question, I'm going to send you all these diagrams. So all these are going to be used in order to internally restrict a limb. Is it clear? So when you have opened during surgery, you want to restrict two bones. It means that you want to connect two bones together. Either you can use a screw that is going to connect the bones together. Is it clear? Or what you can do is that you can place a plate that you put screws on this side, and then you put screw on this other side in order to connect the bones together. Are you seeing? So all these are elements of internal rotation. Another element is to place an intramedullary nail. So I'm going to put all that on the commentary part. Now for the external restriction can either involve two things. Either it is cast or it is an external fixator. Is it clear? An external fixator is placed during surgery. Is it clear? An external fixator is placed during surgery, and then a cast is placed after a closed reduction. And cast consists of two things. It consists of plaster of Paris and also consists of fiber glass. Those are the two main things that the cast is constituting of. Is it clear? A cast consists of two things: a plaster of Paris or fiber glass. Plaster of Paris is what is making you to be dirty. It's very whitish, and the fiber glass, though it's still whitish, but it's more cosmetic, is more clean and all that, but it's more expensive too. So those are the different elements. With the external reduction, you need to know that it is made up of an external bar. When you are seeing people in the hospital with an external bar like that, and then there are screws with pins on their legs like that. So this is an external bar. This is a screw of the screw of the external fixator, and then there are pins entering now into the leg of somebody. Is it clear? All that is, this one is an external fixator. And I'm going to now go to the next part. What are the indications for surgery, and what are the indications in order to do internal fixation or external fixation, and when are the cases that you do instead an external restriction with a cast. So those are the different elements you have to understand.